Hello, what's up, you guys? And yes, today we'll be talking about OET 2.0, listening tips and strategies. If you have any more questions or if you want anything that you want to ask, you can contact me from my email address, which is oettutordoctor@gmail.com. So in the listening section, there will be three parts, and the total time will be approximately 40 minutes. And previously, OET listening had two parts, which were part A and part B. And now there will be three parts from September 2018 onwards. Many people think that OET exam will get more complicated or more complex, or it would be harder to get the necessary scores from the reading or listening with the OET 2.0 version. But I completely disagree with this. It will be easier to pass, in my opinion, in the listening especially. Because it's much more structured from now on. So in the part A, there will be two different extracts, and extract just means recording, and you will hear a healthcare professional talking to a patient. And in the part B, there will be 6 different extracts, and you will hear various people talking in a healthcare setting. And in the part C, there will be 2 different extracts, and you will hear a healthcare professional or an expert talk about their area of expertise. This is like the longer type of speech, and this might be a seminar or a lecture or a conference about an academic topic. Before going into tips for the additional parts, I just want to have a quick look on the question paper that you will be given in the test. I got this question paper from the OET's official website. You can also download this. There are also 2 sample mock exams that you can download and practice your skills. So you will fill your information. Do not forget to sign your question paper in the exam. So in some questions you need to fill a blank, or you need to fill the circle like in multiple choice questions like this. You will be using a 2B pencil. You will be using this type of pencil also in the reading part B and part C. Okay, in the part A, there will be like gaps like this, and you need to fill these by listening to the script. It's mostly about you will hear a conversation between a doctor and a patient, and you will fill this information about the patient. In the previous version of the OET, there were only blank lines in part A. You need to fill everything. But from OET 2.0 version, as you can see, it's much more structured, and listening, in my opinion, will be easier than the previous version. And you can see this is another patient, second extract, and you need to also fill this information about the patient's motive, why this patient is visiting this physician, their medical history, the advice that the physician gives, and the outcome. And in the part B, you will see some conversations, and you need to answer these multiple choice questions. For example, like, what does she warn her colleague about? Or he says that errors in dispensing medication to patients usually result from, like, these are mainly general ideas or the main topics about these conversations. And in the part C, as I said, you will hear an expert talking about the topic of their expertise. For example, you see there's a cardiologist who's an expert on Chagas disease, and you will hear you will hear the longer monologue about this disease from this person, and you need to choose the correct answer. And there will be two extracts. For example, in here there is an occupational therapist giving a presentation to a group of trainee doctors. As I said, it could be a conference, a seminar, a presentation, an academic lecture, like monologue, longer type of speech. And there will be some multiple choice questions that you need to answer. Okay, let's move on with the tips. For tips for the part A, there will be 30 seconds to look at questions. So you need to make the most of this time. You need to read the questions, and I want you to underline if you will hear things like ID number or date of birth or any kind of like information that might be easy to miss while listening. So just underline or put an asterisk, a star next to it. Therefore, you will give your brain the message, okay, we're coming to an important part. So boost up your attention while listening to this part. And I would advise you to familiarize yourself with different English accents, because OET 2.0 will be more global and new accents will be introduced. Before this, there were mainly Australian accents, and it tends to be quite hard to understand for other people who are not very familiar with Australian accent, because they tend to speak faster and it's a bit sleazy. So nonetheless, you need to be familiar with different English accents like British accent or Canadian accents or American accent. So this should, like different type of speaking should not set you from understanding the context of this speech. As I said, note taking was important before, but you will have more structured answer paper. Therefore, you only need to fill the gaps. And part B and C, there will be multiple choice questions. And the most important skill that you need to pay attention to will be signpost language. Use the signpost language to anchor your attention to the part of that speech. So let's talk a little bit about signpost language. Signpost language is the type of language that we use in presentations, and it allows our audience to know what we are talking about at the moment and add structure to our speaking. If you're giving presentation, you'll be using signpost language in order to give an efficient presentation. For example, when you start the presentation and welcome people to your speaking, it's things like, welcome to this presentation. What I'm going to talk about today is, for example, when you hear something like this, you immediately know the topic of this conversation or this lecture. Today I'm going to discuss the topic of my presentation today is, like, I want you to pay attention, this kind of like anchoring points. Like these types of language tell you what's coming next. Therefore, you can predict what's coming now, and you can match this with your answer on your question paper. For example, there might be some language related to outlining the content of the presentation, like firstly I will be looking at, secondly we will consider, then I'll explain how, and finally I'll demonstrate, blah blah blah. So there will be this kind of like structure into the speech, and I want you to make the most of these clues, these cues that will help you answer the questions in the listening part better. So there will be like, they might ask you the topics, the next points, like points of covered in that presentation. So you might hear things like, let's move on to Now that we have discussed like summarizing the previous point and moving on to the next point, next let's look at I like now to discuss, and like there will be some concluding and summarizing sentences, and these are the cues referring to the points that you don't want to miss. And let me give you some tips to how to prepare. For reading and listening, you don't need much tutoring. You don't need anyone to teach you how to read and how to listen. You just need to practice yourself. Listen variety of healthcare related conversations, lectures, seminars. I mainly advise my students to listen AMJ's podcast, which is Medical Journal of Australia, and this podcast would allow you to be familiar with the Australian English. And TED Talks. TED Talks are great if you want to improve your listening skills. And they're great grand rounds on iTunes. I personally use iTunes for my podcasts. And I really like these grand rounds from University of Arizona, and it's about internal medicine. And there are a variety of speakers each week who give updates or information about various topics related to internal medicine. As I said, if you have any further questions, you can always contact me by my email address or commenting below. Don't forget to like this video and subscribe to my channel. I update every single day. Sometimes I upload a new video twice a day. So make sure that you will not miss these valuable tips from an experienced doctor who passed his own OET test. And also I provide tutoring, essay corrections, one-on-one or group lessons, speaking practice. If you want these types of services, you can contact me by my email address, which is oettutordoctor@gmail.com. Have a nice day. See you in the next video.